Member Fraser-Nicola.
Thank you, Mr. Speaker. I rise today to speak on the motion, and it's a motion that we need to listen to. Be it resolved that this House agree that current measures have not adequately addressed the opioid epidemic and commit to making mental health and addictions a priority in British Columbia. As hospitals across the province continue to experience staffing shortages and a lack of available beds with the overwhelming number of COVID patients, the mental health strain it is having on our frontline workers is unimaginable. COVID has shed light on many gaps in our healthcare system, and my heart goes out to all healthcare and emergency workers currently working on the front lines in our fight against the COVID-19 pandemic. The ongoing pandemic, along with BC's second public health emergency, the opioid crisis, is not only impacting the mental health of our healthcare workers, but it's impacting the mental health of all British Columbians. Many people living with addiction struggle with their mental health as well, which is why the ministry today is tasked with supporting both. I firmly believe that we cannot tackle the ongoing overdose crisis without also tackling our inadequate mental health supports. As a former school board trustee and as a parent myself, I also believe that this needs to start with our children, in our homes and in our schools. And I would like to use my remaining time today to talk about the mental health challenges in our education system that desperately need to be addressed. Our school years are some of the most formative years of our lives for our minds and our mental well-being. And the mental health challenges our children develop in these crucial years can persist long into adulthood. If we truly want to change how we approach mental health, it starts with teaching our children that it's okay to talk about their struggles. We also need to ensure that they have the resources they need to identify and address their personal mental health challenges. While regular school responsibilities are strenuous enough for a student, our children are continuing their learning and growth amidst the constant threat of the COVID pandemic. These last 2 years of school have undoubtedly been the most challenging that students, staff, and families have ever faced. And government has a responsibility to give British Columbians the tools and resources they need to ensure our children feel safe and supported at all times. When fighting an invisible enemy, knowledge is the greatest tool we can give students and parents for them to have confidence in their decisions. When the province eliminated COVID notifications, this created an incredible amount of anxiety and safety concerns for students and parents. Even now, by creating lengthy pathways for parents to gather the information they are looking for, we are putting unnecessary strain on people's mental health. British Columbians want an in-depth update on the progress of ventilation upgrades in schools, more remote learning options for students and families, and enhanced contact tracing in classrooms to identify clusters and outbreaks, and for government to enact greater use of rapid testing as an additional layer of identification and protection against COVID in classrooms. We rewrite the narrative and show our children that they have places and people they can talk to when they are feeling anxious, insecure, or unsafe. A place where they are free to share the challenges they are experiencing both in school and at home. Now is the time to review and improve the mental health resources available in schools and ramp up the discussion of how better to address mental health in our classrooms. No teacher, staff, or child should ever enter their classrooms feeling unsafe. The time for action is today.